Hi, this is Dr. Kang, the scuba diving story, and today's story is about arrhythmia and diving. Arrhythmia, for me, very difficult to pronounce, so let me go for like irregular heartbeat. Irregular, it's not easy to. This irregular heartbeat is not uncommon. It's not common, but it's not uncommon. Quite a few number of people are suffering from arrhythmia, and I receive phone calls from arrhythmia divers if it is okay to dive. So I thought I should somehow summarize this and be of some help to whoever needs it. We'll go for some overview types and relationship or effect on diving. This is regular heartbeat, the same beat keep on going. But arrhythmia, there's a pause of beat here. So this is just one of the example. There can be different kind of irregular heartbeat, and usually when this hits you, we feel like can't do anything, very tired, and you can also hear the heartbeat, or you can feel it by tuk 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 tuk. You can feel the irregularity. So first time maybe you think, what is this? But when you go to hospital and you get the diagnosis, you know when it comes. So the normal heartbeat is from 60 to 100 per minute, but healthy normalcy is usually like from 80 to 100. Some slow beaters, 60 is recorded, and we just include that within the normal heartbeat. But arrhythmia is abnormal heartbeat from abnormal electric wiring that is present in your heart. So there are several different types of arrhythmia, but hope you can see this. Here is a node which is like a battery pack, and from here it emits some electric pulse to this node. So depending on where they are named like a supra-aortic or atriovenous node. But anyway, electric pulse goes here, and from here squeezes the heart muscle. So it comes very regularly. But these supraventricular tachycardia, especially when it is paroxysmal, I mean a very serious case, you can lose your consciousness. There are other type like a ventricular, which is not supra, it's just the ventricular tachycardia, atrial fibrillation, and the types really matter when it comes to diving, but that's something that your doctor can figure out and let you know. So about arrhythmia and diving, some serious arrhythmia, it's absolutely contraindication to diving, because you lose your consciousness on the water, it means you drown. So doctors can never say yes to that. supraventricular tachycardia, which is one of the worst form. It's unpredictable on its onset, and maybe if you put your face in cold water or even your hand in cold water, it can be triggered and then it begin to come. So when you have serious case of arrhythmia, you don't dive, you have to stop diving. Also, if you are on arrhythmia medication, like myself, you're not supposed to dive. Me, I have atrial fibrillation, and once it got really bad, and I took one medicine, it didn't work so well, so I took the second level medicine for almost 5 years so far, and it's under control. Like once a year or once every 2 years, I feel something coming, but it doesn't stay long. That's why I can still dive, even if I'm on medication. So if you have arrhythmia, you really need some very, very complete and detailed medical examination. Not only heart, you have to check your kidneys, you have to check your lungs, livers, because arrhythmia and the arrhythmia medication can affect other major organs as well. And only very recently, some generous doctors, diving doctors, cardiologists, they are beginning to let mild case arrhythmia patient to dive. But you should never dive some technical diving in which you have to finish your decompression options. If you have arrhythmia while you are having decompression stop, you cannot stay there, which means you don't finish the decompression, then at the surface maybe decompression illness is waiting for you. You should also not be engaged in overhead environment diving, caves or wreck penetration, in where you cannot make a direct ascent toward the surface. So almost all heart disease, if you are allowed to dive, you have to stay within no decompression limit and no overhead environment. So I hope I made some points on arrhythmia and diving. If you have serious case, forget it. But if you have a mild case and if your arrhythmia is under control, you can probably engage in diving activity and stay within no decompression limit. So it was about arrhythmia and diving today, and thank you very much for your attention.